Congress has not been able to agree on federal government funding, which means as of October 1st, 2025, the federal government has shut down. And many experts don't expect that to change in the near future. That has led some state and federal agencies to craft messages to public benefits recipients to assure them that most public benefits will continue in the near future, including Medicaid, Medicare, Social Security, food assistance benefits, and WIC. If families experience anything in the short term, it might be a slowdown in services as some federal workers are furloughed. Here's how we got to this point. A continuing resolution to keep the federal government funded needs 60 votes in the Senate, which means it needs to be bipartisan. Democrats have insisted on some changes to health care provisions in a continuing resolution, like extending the Affordable Care Act's enhanced premium tax credits, or even reversing some of the Medicaid cuts that were included in the last federal budget. Those proposals have not succeeded, and therefore we are continuing with the shutdown. The last shutdown was 2018 to 2019. It lasted 35 days in the first Trump administration. The impact of the shutdown, first of all, federal agencies have been directed to implement their shutdown plans. Some agencies, like Border Security and Immigration and Customs Enforcement, will not be impacted by the shutdown. Most Medicaid and Medicare services will continue. There are a few exceptions, like some telehealth services or hospital-at-home services. Social Security checks are not impacted. They will go out as usual. Social Security staffing may be reduced, so there might be a slowdown when trying to call the agency. Staffing overall will be impacted. Government employees deemed non-essential are going to be temporarily put on unpaid leave. That's about 40% of the federal workforce, or about 750,000 workers. U.S. Department of Health and Human Services alone will furlough about 41% of its workforce, which is about 32,500 federal workers. On September 30th, in anticipation of a shutdown, Wisconsin's Department of Health Services issued a Florida Health Partners update with clarity on member benefits during a federal government shutdown. Namely, Badger Care and Medicaid members will still have coverage and can still get care and services that they need. FoodShare members will receive their October benefits on their Quest card on the normal schedule, and WIC participants can continue to use their WIC benefits. And the department says they will continue to keep members updated on their relevant news websites, and we link to those below, along with other news sources on the federal government shutdown.